Dear friends, today we will be demonstrating how to square the pelvis in fixed abduction deformity of the hip joint and a unilateral hip pathology. Patient's ASIS on the affected side will be at lower level as compared to the opposite side due to compensation by the pelvis and spine if the patient has attempted weight bearing and ambulation. If the patient is not ambulated, both the ASIS will remain at same level and requires no further squaring of pelvis. In that scenario, fixed abduction deformity of the affected hip joint can be measured directly with the help of goniometer. Today's demonstration will be on a patient with unilateral hip pathology whose ASIS on the affected hip joint is at lower level compared to opposite side due to compensation by the pelvis and spine on weight bearing and ambulation. In this case, squaring of the pelvis means bringing the lower level ASIS of the affected side in line with the opposite side ASIS by abducting the affected hip joint. Squaring of the pelvis reveals the amount of fixed abduction deformity which has been concealed by the compensation of pelvis and spine. The purpose of squaring the pelvis is to eliminate the compensation of the spine and pelvis so that the amount of actual concealed fixed abduction deformity of the affected hip joint can be revealed and measured. The free range of abduction movements of the affected hip joint can be measured. The true length of the affected limb can be measured by keeping the opposite limb in identical position. Bryant's triangle on the affected limb can be drawn and measured by keeping the opposite limb in identical position. Dr. Gautam will be demonstrating squaring of pelvis in fixed abduction deformity. This patient has fixed abduction deformity of the right hip joint. So, ASIS on the right side is at lower level as compared to opposite side ASIS. Start abducting the affected hip by holding the leg above the ankle with one hand and with the thumb of the other hand over the ASIS of the affected side. Initially, there is free abduction at the hip joint, hence ASIS on the affected side will remain stationary. Continue to abduct and ASIS on the affected side will start moving upwards after the free abduction is complete. Stop abducting once the ASIS of the affected side comes to lie in line with the opposite side ASIS. Next, start adducting the affected hip joint and the moment the ASIS on the affected side just begins to move down, stop the adduction. Now the pelvis is squared as both ASIS are at the same level. Now place the goniometer on the affected hip joint with one lip of the goniometer parallel to the imaginary midline of the body and other lip of the goniometer along the long axis of the thigh. This angle is the amount of fixed abduction deformity of the affected hip joint. For instance, it is 20 degrees in this case. Now, to measure the free abduction moment of the affected hip joint, start abducting the affected hip joint again and stop abducting once ASIS on the affected side just begins to move upwards. Now, place the goniometer on the affected hip joint with one lip of the goniometer parallel to the imaginary midline of the body and other lip of the goniometer along the center of long axis of the thigh in its present position. This reading here shows as 40 degrees in this case. So here the free abduction of the hip joint is from 20 to 40 degrees. This is finally read as 20 degrees of fixed abduction deformity and free abduction from 20 to 40 degrees. This video helps in understanding how to square the pelvis in fixed abduction deformity of the hip joint in a unilateral hip pathology. In our next video, we will be demonstrating how to square the pelvis in fixed adduction deformity of the hip joint. Kindly practice the squaring of pelvis repeatedly even on normal individuals. Kindly share this video so that others too can learn. Please do subscribe to this channel to keep getting more videos on clinical examination. If you like this video, give us a thumbs up, and if you did not like it, you can give us a thumbs down too. Thank you viewers, we will meet you again in our next video.